Thank you for being part of Multiple Sclerosis News Today, official coverage of CMSC 16, and to bring to this family interview. MS patients now have a variety of treatment choices, but consistent validation and proof of comparative effectiveness is important to being able to judge the most appropriate treatment. Given this, why was the decision made to have Rebif, the exclusive interferon beta-1 treatment offered on CVS Caremark National Formulary in the US? And what clear benefits led to this decision?
Well, we are very grateful that there are treatment options for people with multiple sclerosis. And as of today, there are 14 separate drugs approved in the United States for the treatment of the relapsing form of the disease. Unfortunately, we do lack randomized clinical trials that would compare all the various combinations of those 14 drugs. And you mentioned comparative effectiveness. We at EMD Serono are committed to providing evidence in the future about the comparative effectiveness of our drugs. That requires us to look at large sets of real-world data and with very careful scientific techniques try to create, if you will, virtual studies that would allow us to make those kinds of comparisons. To date, frankly, the evidence doesn't exist to pick a true winner using those kinds of techniques. And so then the decision to treat an individual patient with an individual drug becomes the art of medicine. And what is the right drug for the right patient at the right time? And that's really quite true. We have with Rebif an advantage over many of the newer drugs in that we've had 20 years of safety experience. What we're finding with some of the newer drugs is while their efficacy in clinical trials is very good, safety issues have emerged with many of them over a period of time. And the advantage of Rebif for the patient population directly is that you know what you're dealing with. You have an effective drug. You have a drug with a well-defined safety profile. And that may be, one of the reasons why Rebif has continued to be one of the first choices in relapsing MS.
The efficacy and safety of Rebif beyond 2 years in controlled clinical trials have not been established. Are there current plans to do so through longer or extended studies?
You're quite right. For all of our clinical trials that have looked at new drugs or even the older drugs, they were all 2-year trials. And the getting any indication of the long-term efficacy and the long-term safety has been problematic, and that is not confined to MS therapeutics. It's true across all of medicine. Our hope is that by looking at large sets of patients in the real world to see how they've done over years or even decades in the case of Rebif, is that we'll be able to identify if there are some long-term safety difficulties. Essentially, if a person has a complication to any medicine, they'll need to see a doctor. They'll need to have a test done. And when you follow the individual healthcare claims that would be submitted as a part of that healthcare process, and now with the era of big medical data, we can actually go back and look at safety with tens of thousands of patients covered or treated with all of our medicines for many years. Newer medicines, we don't have quite that history. The older medicines, we do. And when we do that with Rebif, and we have 3 scientific posters presented here, we find that even after you try to adjust for how sick a patient is, those people treated with Rebif have fewer exacerbations and lower need to access health care and proportionately lower health care costs than do some of the newer drugs, such as Tecfidera and Aubagio. So I think you'll see that the hope of big data, a hope of having the HIPAA, which is a Patient Privacy and Portability Act, which allows us to collect financial information which reflects disease activity, that will begin to answer some of these very important questions that you've raised.
How does Rebif differ from other drugs aimed at treating relapsing MS symptoms?
Rebif is a beta interferon. and beta interferons are modulators of the immune system. And in such way, they tend to decrease the tendency of MS patients to have inflammation. There are other drugs for MS, and a lot of the newer drugs for MS are more immunosuppressant. They may eliminate certain white blood cells from the circulation, such as Lemtrada, alemtuzumab. And those drugs work in another way to decrease inflammation, but it's really to sort of eliminate cell types. So of the 14 drugs, all of them have a little bit different mechanism of action. And what we really hope in the future is to be able to select the drug with the mechanism of action that would be most appropriate for the type of MS any one individual might have. That's the essence of what we call personalized medicine. Unfortunately, we're not there yet. There is no imaging test, there's no blood test, there's no clinical characteristic that a doctor can find that will allow us to immediately say, this is the right drug for you at this particular point in your illness. It's the art of medicine to try to select that, and we really do feel that Rebif has a very meaningful place in that kind of approach to the treatment of MS.
Can you talk about the MS Lifeline support service and its importance to MS patients using Rebif and their caregivers? How can it help personally and financially relapsing MS patients cope with their disease?
MS is a chronic disease, and it affects people in so many different ways. And it can affect them, we think of it most commonly as affecting how well you move, but it can affect how well you see, it can affect how well you can feel things, it can affect how well you think. And it also interferes with your ability to work, your ability to have good, solid relationships, and it does so over decades. So the treatment of MS has to be comprehensive. And I'm very proud of EMD Serono's Lifelines because this is a group of healthcare professionals, nurses, that are available 24/7 to listen to a huge range of issues that patients with MS have and appropriately route them to the healthcare practitioner that may be able to address it, or at least teach patients the kinds of questions they need to ask their healthcare provider, whether it's their obstetrician or their neurologist. MS Lifelines has answered 4 million such calls since it was begun a little over a decade ago. And I think it represents a commitment of our company to have a broader, more holistic approach to the treatment of MS than any one given drug.
Thank you very much.
Thank you.